All
Perfect.
right, so thank you very much for inviting us to talk on this project. We're very proud to be representing Curtin and Healthy Connections project to a global audience. So I'd like to introduce also my colleagues, Associate Professor Sonny Pham and also Dr. Kit Yan Chan, who work very closely with me. They are experts in AI. I am also have been in AI for a very long time. I'm very interested in looking at projects where there is a very tangible outcome to people. So I really like to scale this type of project. And we were very lucky to be given this opportunity to work in the Pilbara. So this is sort of a remote region, sort of 2 hours north of Perth. We're bringing a mobile medikit to remote the community of the remote regions. So please join us. Okay. So for the folks that aren't familiar too much with WA, we are based here in the Perth metro area, but we're working up here in the Pilbara region. This is a 2 hour or more flight. And we are working with the people in the Western Desert around here. This is a really sparsely populated region. It's a very, desert type terrain. And the infrastructure there is much less than what we have in the metro areas, where we have a lot of infrastructure and a lot of medical support and needs. So we were first given this project because we were part of what's called the WA Health Challenge. The WA government put out a call to improve remote and regional health, and they attached a $5 million prize to it. So we were one of the first round finalists. There was 10 finalists out of 100 or so global finalists. We were given some money to build out proof of concept over 1 year. That competition finished last August. We didn't end up winning, but we made every possible attempt to win. So we did, in all things considered, a really excellent job. So as I mentioned, the Pilbara here it's got lots of remote communities. It's got a high percentage of Aboriginal Australians than say in the metro area. However, the Aboriginal Australians in this region are some of the most disadvantaged in the world because of the really long distances that they need to travel and the lack of infrastructure and support and medical support and so forth. So they suffer from some of the chronic diseases that may be absolutely preventable in a more metro context. So they suffer from cardiovascular issues, a lot of diabetic problems, and renal conditions as well. And so when we go up to these regions and we visit the people that live up there, they are very, very well surrounded by relatives and friends that are falling sick to some of these conditions. All right, so I am showing you a sort of closer up map. We are looking now in that sort of Western Desert region in the orange here. And you can see in Newman is where we kind of fly in, fly out from most of the time. And that's like a mining, sort of mining town, an iron ore mining town. And away from that, that's 2 hours drive is Jigalong. Then you might have Bangor, Punmu, Coonawarrigi. These are like 4, 6, 10 hours driving. And sometimes you might reach them through a light plane. So we've been very lucky to be able to visit some of these areas. And often it's, it's always quite unpredictable because sometimes, there's bad weather or the roads are in bad condition and so forth, and you can't get to these regions very easily. The folks living out in these regions, they, need to travel 140 to 500 kilometres to access their care. They are very traditional and transient. They live a very transient lifestyle. So they follow a lot of law, men's business, women's business, business, and they need to be moving around different communities at particular times of the year, following their traditional customs. They have language and cultural barriers because their English language might be their third or fourth language. And so it's really difficult for them to access healthcare and so forth in the Western modes of context. And I'm going to go on to the next slide. So over about 18 months, We did a lot of consultation with the community themselves, with different support groups, with different exercise groups that work in the region. We worked with nurses and doctors in the metro area that supported some of the patients that travel down here. We worked with hospitals here, and we also worked with clinicians that were up in Newman and out and having little sort of nursing posts out in those very small communities. And also some of the Aboriginal medical services and the WA Country Health Service. We got a lot of advice and we talked to lots of people. We wanted to build something that would address some of the things that we learned. So patients need this culturally secure healthcare, which is based around good understanding of language and culture both ways, from Western to Māori and so forth. The trust in building relationships with healthcare workers. They were very worried about being away from their families when they received treatment, so not wanting to come down to Perth, but preferring to stay more local. And we wanted people to have a lifetime approach to healthcare, so to be educated and to understand what good health would look like. In terms of health workers, we knew that there is a health worker shortage in these areas, and we want people to have the opportunity to upskill and train to have those remote practice skills. So we ended up building a proof of concept, and this is our mobile Medikit. I took on board up to 30 students to work with me from AI, cybersecurity, networking, IoT, co-supervised by a lot of my colleagues, including Sunny and Kit. And we have this as a mobile kit that goes out, it's satellite connected. It's got a screen that is used by the clinician, and we have like an interface that is for the clinician to carry out their consultation. For phase 2 of the work, we have been very lucky to secure a troop carrier that's been refitted as a mobile clinic. We'll have that stationed up in the Pilbara. It'll drive around with the Medikit on it and go out into community. And these are some of my students and nurses that worked with me on the project as well. And one of my colleagues, Professor Andrew Marana, who's a clinician. So I'll just show you some of the screens that we have on the Medikit. There's some guided consultation, and it makes good use of what we call modes of yarning. So 3 stages of yarning that really introduce and make the community member feel really at ease with the clinician, because we're talking more in the sense of yarning as opposed to question answering. There's telehealth aspects. There's also a virtual the virtual health assistant, chatbot. We also have metrics that we take, so we're able to take ECG, and this is one of the ECG traces that we've been able to take when we're out in community using the Medikit. We also have generative AI interpretation of some of those traces, and we're doing a lot of work around that as well. We've put in a lot of effort around making the user interface very culturally sensitive, using particular motifs and language. We have some work on AI language translation from English into Māori and Māori into English and so forth. And that's sort of another big discussion in itself. We have a paper on that, so that's also something, if people are interested in that work, we can point you to that. And these are some of the interfaces where we have paid a lot of attention to visually representing information to Māori people, where it's very visual based. So your blood pressure risk is, for example, medium. There's a big part that pops up to show you where you are on the scale. These are some symbols that indicate how you might feel if you're experiencing this level of blood pressure. There are some oral spoken words that we're working on still to come, to help that translation piece. There is some auto-generated, AI-generated recommendations around health and well-being. And then also we have some visual representations of, for example, a baby malu is often a metaphor for an ECG trace, which is irregular and weak. If we had a very regular heartbeat, we might have a picture of a red kangaroo there as well. Now, we also have other work where we have a camera on board, and We are able to scan inside the mouths of patients to detect things like strep throat, which is something that could indicate rheumatic heart disease later down the track. And also, we have a camera that looks at skin conditions. So we've used AI, computer vision, to be able to detect some of the skin conditions that people are experiencing. We also have a companion app that patients can access themselves on their phones. So the Madu and other Aboriginal communities are particularly remote living folks. They are the younger folks are becoming a lot, they use mobile phones quite a lot. So we know that this will be a good tool for them to track when their appointments are coming up, what pills or papers they need to bring to consultations, like what a little bit around the education piece. So what are good healthy recommendations for living well and so forth. So we have that work also been done by one of my honours students. I don't want to go too much further, but I do want to find out how much time we've got left, because I want to ask my colleague Sunny and Kit to talk about the data aspects and the privacy aspects.
Yeah, we have about 2 to 3 minutes because we
have
two
okay.
more talks.
Sunny, do you mind jumping in?
All right, can you hear me?
Yes.
Yes. Okay. Yeah. Okay. Yeah. Thank you, Susanna. Thank you, everyone. So I want to basically quickly talk about the data aspect of this. So as with any application involve patient data, we treat the security and privacy of the data seriously, and there are certain principles that we need to follow. The first principle is the care principle. If you ever heard about it, so it is about providing the indigenous people, especially in Western Australia, right, the ability to control the data. The data need to be collected, with their consent, and then the indigenous people own the data, and then everything that we do here basically supports the indigenous people. So that's something that we actually have that in the original design. There's also like the FAIR principle that has to do with making sure that the data is findable, accessible, interpretable, and reusable. So that's something that we also need to have that in the design too. Apart from that, layers of data security, like to do with authentication, encryption, and privacy, they are also part of our design. And so we can address that in the Medikit, and we are still I think working on making sure that our Medikits is further improved and further benefits of the indigenous people in Western Australia.